Your arteries are slowly turning to stone. Every day after age 60, your blood vessels become a little stiffer, a little less flexible, a little more resistant to blood flow. And this silent process is driving your blood pressure higher, forcing your heart to pump harder, increasing your risk of stroke and heart attack with every passing month. Most doctors will just prescribe another medication. But here's what they don't tell you. A 2023 meta-analysis of 270 randomized controlled trials with over 15,800 participants found that a specific type of exercise lowered blood pressure more than walking, more than cycling, more than running, more than any other form of exercise studied, and it only takes 10 minutes a day. Today, I'm going to show you the exact 10-minute daily routine that can lower your blood pressure by 8 to 15 points naturally. This routine targets the 3 hidden drivers of high blood pressure that medications can't touch: arterial stiffness, nervous system overdrive, and cellular dehydration. But I'm not just going to give you the routine. I'm going to explain exactly why each component works at the physiological level, because when you understand the mechanism, you'll understand why this approach succeeds where medications alone often fail. Let me give you a quick glimpse of what we're covering. Minutes 0 to 6. Arterial flexibility training. I'm going to show you the specific isometric exercises that a British Journal of Sports Medicine study found outperformed every other exercise type for blood pressure reduction. Not walking, not running, not cycling. Isometric holds. And I'll explain the surprising mechanism that makes them work. Minutes 6 to 8. Vagal nerve reset. Your vagus nerve is your body's brake pedal. When it activates, heart rate slows, blood vessels relax, and blood pressure drops within minutes. I'm going to show you the exact breathing pattern, 6 breaths per minute, that switches on this calming response on command. Minutes 8 to 10. Strategic hydration. Most people don't realize that even mild dehydration raises blood pressure. When your body is low on fluid, blood vessels constrict to maintain pressure. Just 16 ounces of water, sipped slowly, can reduce vascular resistance immediately. Combined, these 3 components create what I call a vascular reset. They address the root causes of elevated blood pressure in older adults, not just the symptom. Here's what the research shows. The STEP trial, published in the New England Journal of Medicine, studied over 8,500 patients aged 60 to 80 with hypertension. They found that intensive blood pressure control significantly reduced cardiovascular events. But what's often overlooked is that lifestyle interventions were foundational to achieving those targets. A 2025 systematic review and meta-analysis in JACC Advances concluded that blood pressure lowering is effective in older people for reducing major cardiovascular events. Nearly all participants aged 65 and older had a predicted net benefit from blood pressure reduction. The routine I'm about to teach you is how you achieve that reduction naturally. I'm Dr. Elizabeth Blackwell. I've spent my career studying the intersection of lifestyle intervention and cardiovascular health. And whether you're on medication and want to optimize your control, or you're trying to avoid medication entirely, or you've been told your blood pressure is creeping up and you need to do something about it, this 10-minute daily routine will give you a tool that works. Before we dive in, I need to understand who I'm talking to. Comment below your current situation. Comment on medication if you're currently taking blood pressure medications. Comment trying to avoid meds if your doctor has mentioned starting medication and you want to try natural approaches first. Comment borderline if your blood pressure is slightly elevated and you want to prevent it from getting worse. Comment optimizing if you already have good control and want to maintain it. This helps me understand what content to create next. Now, let me tell you about Wallace. Wallace was 67 years old when his doctor told him his blood pressure was consistently reading 158/94, stage 2 hypertension. His doctor wanted to add a second medication to his existing prescription. Wallace was already dealing with side effects from his first medication: dizziness when standing, fatigue. He didn't want to add another pill with more potential side effects. His doctor said, "Fine, but your blood pressure has to come down. Either more medication or something has to change." Wallace found this routine. He committed to 10 minutes every morning, right after his coffee, for 90 days. At his next appointment, his blood pressure was 138/82. His doctor was surprised. At 6 months, he was at 128/76. His doctor reduced his medication. Wallace isn't unique. He followed a specific protocol based on the mechanisms I'm about to explain. The same mechanisms that research has shown can produce blood pressure reductions equivalent to prescription medications. Let's start with the first component, arterial flexibility training, minutes 0 through 6. Before I give you the exercises, I need you to understand what's happening inside your blood vessels after age 60. Think about your arteries like garden hoses. When a hose is new, it's flexible. You can bend it and it bounces back. Water flows through smoothly and pressure stays stable, but over time, that hose gets stiff. Cold weather makes it brittle. Years of use cause it to lose elasticity. Now, when water tries to flow through, the hose can't expand to accommodate the pressure. Instead, the pressure builds. Your arteries behave exactly the same way. This process is called arteriosclerosis, and it's the primary driver of systolic blood pressure elevation in older adults. Your arterial walls accumulate collagen and calcium, the elastic fibers break down, the vessels become rigid. This is why systolic blood pressure, the top number, tends to rise with age even when diastolic pressure stays stable. The arteries simply can't flex to absorb the pressure wave from each heartbeat. Now here's what most people don't understand about blood pressure medications. Most medications work by either reducing blood volume, relaxing blood vessel walls, or reducing heart output. They're treating the symptom. They're not reversing the underlying arterial stiffness. But there's a type of exercise that actually retrains your blood vessels to relax and dilate more effectively. It's called isometric exercise. Isometric exercise means your muscles contract and generate tension without moving. You're holding a position, not performing repetitions. Think wall sits. Think planks. Think squeezing a stress ball. A landmark 2023 meta-analysis published in the British Journal of Sports Medicine analyzed 270 randomized controlled trials covering over 15,800 participants. They compared aerobic exercise, resistance training, high-intensity interval training, combined training, and isometric training. The results were clear. Isometric exercise produced the largest reductions in blood pressure of any exercise type studied. Specifically, isometric training reduced systolic blood pressure by an average of 8.24 mmHg. Aerobic exercise reduced it by 4.49 mmHg. Resistance training by 4.55 mmHg. HIIT by 4.08 mmHg. Isometric exercise was nearly twice as effective as walking, and when they looked at specific exercises, isometric wall squats, also called wall sits, were the single most effective exercise for reducing systolic blood pressure. They had a 90.4% probability of being the most effective intervention. To put this in perspective, an 8 to 10 point reduction in systolic blood pressure is equivalent to what many first-line blood pressure medications achieve, except there are no side effects, no pill costs, no drug interactions. So why does holding a static position lower blood pressure more than running or cycling? Here's the mechanism. When you hold an isometric contraction, blood flow to the working muscles is partially restricted. Pressure in those muscles increases. Your blood pressure actually rises slightly during the hold, but then you release the contraction. And when you do, the blood vessels that were compressed now dilate, opening wider than before to allow blood to rush back into the muscle. This is called reactive hyperemia. Over time, repeating this compression-release cycle trains your blood vessels to dilate more effectively. It improves what's called endothelial function, the ability of your blood vessel walls to relax. It reduces total peripheral resistance, the amount of resistance blood encounters as it flows through your system. A 2022 systematic review published in the Journal of Hypertension examined the mechanisms behind isometric exercise blood pressure reduction. They found that reductions in total peripheral resistance, mediated through enhanced autonomic vasomotor control, were primarily responsible for the improvements. In other words, isometric exercise actually retrains your vascular system. It improves the flexibility and responsiveness of your arteries at a cellular level. Now let me show you exactly how to do this. The two most effective isometric exercises for blood pressure are wall sits and planks. Wall sit. Stand with your back flat against a wall. Slowly slide down until your thighs are at a challenging angle. This doesn't need to be a full 90-degree squat. Start wherever you can hold the position for 30 seconds without significant discomfort. The key is steady muscular tension, not pain. If you have knee problems, stay higher up the wall with less bend in your knees. If getting low aggravates your joints, modify. The goal is sustained contraction, not injury. Hold for 2 minutes. Rest for 1 minute. Repeat. Plank. You can do a traditional plank on your forearms and toes, or modify by keeping your knees on the ground. If getting on the floor is difficult, you can do an incline plank with your hands on a countertop or sturdy bench. Again, hold for 2 minutes. Rest for 1 minute. Repeat. The total protocol for arterial flexibility training is 6 minutes of work, 2 minutes of wall sit, then 2 minutes of plank, then 2 minutes of wall sit. Or you can alternate, plank, wall sit, plank. The order doesn't matter. What matters is accumulating 6 minutes of total isometric hold time. If 2 minutes is too long initially, start with 30-second holds and build up over weeks. The research shows that even shorter holds produce benefits, and you'll develop endurance surprisingly quickly. A study of unmedicated hypertensive adults found that wall sits and hand grip exercises performed 3 times per week produced mean reductions in systolic blood pressure of 11.2 and 12.9 mean mmHg, respectively. And these reductions were maintained when exercise frequency was reduced to once per week. That's a critical point. Once you've established the training effect, you may be able to maintain benefits with less frequent sessions. But for the first 12 weeks, commit to daily practice. Let me tell you about Dolores. Dolores was 72, with blood pressure consistently around 152/88. She was on lisinopril but still not at goal. Her doctor suggested adding a second medication. Dolores had arthritis in her knees and couldn't do squats comfortably, so she modified. She did wall sits at a very shallow angle, almost standing upright, just enough to feel tension in her thighs. She did planks on her knees at a countertop. For the first 2 weeks, she could only hold positions for 45 seconds, but she did it every single day. By week 4, she was holding for a full 2 minutes. By week 8, her home blood pressure readings had dropped to the 130s over low 80s consistently. At her 3-month appointment, her doctor confirmed 134/80, still on the same single medication, but now at goal. The arterial flexibility training had done what increasing her medication couldn't. Comment wall sit if you're going to start incorporating wall sits into your daily routine. Comment modified if you'll need to modify the exercises for joint issues or mobility limitations. Now let's move to the second component of this routine, minutes 6 through 8, the vagal nerve reset. Your vagus nerve is the longest nerve in your body. It runs from your brainstem down through your neck, chest, and abdomen, connecting your brain to your heart, lungs, and digestive system. The vagus nerve is the primary component of your parasympathetic nervous system, the rest and digest side of your autonomic nervous system. When the vagus nerve is activated, heart rate slows, blood vessels dilate, stress hormones decrease, and blood pressure drops. But here's the problem. After age 60, many people get stuck in chronic sympathetic overdrive. That's the fight or flight side of the nervous system. Even when you're sitting quietly, your body may be physiologically responding as if you're under threat. This happens because the parasympathetic system weakens with age. The vagus nerve becomes less responsive. The brake pedal that should slow your heart and relax your vessels gets worn out. Chronic sympathetic overdrive means elevated cortisol, elevated heart rate, constricted blood vessels, and elevated blood pressure, even when there's no external stress. But here's the remarkable thing. You can activate your vagus nerve on command through a specific breathing pattern. It's called resonance breathing or coherence breathing, and the research behind it is extensive. A meta-analysis of 223 studies on voluntary slow breathing found consistent increases in vagally mediated heart rate variability during, immediately after, and following multi-session interventions of slow breathing practice. The optimal breathing rate for vagal activation is approximately 6 breaths per minute. This is your cardiovascular system's resonance frequency, the rate at which heart rate and blood pressure oscillations naturally synchronize. When you breathe at 6 breaths per minute, you're matching your respiratory rhythm to your cardiovascular system's natural frequency. This maximizes the amplitude of heart rate variability and enhances what's called baroreflex sensitivity, your body's ability to regulate blood pressure in real time. A systematic review and meta-analysis published in Mindfulness in 2024 found that slow-paced breathing showed significant immediate effects in reducing systolic blood pressure, with effects persisting after the breathing session ended. Here's exactly how to do resonance breathing. Sit comfortably with your back supported. You can be in a chair or on the floor, whatever is comfortable. Close your eyes to reduce visual distraction. Inhale slowly through your nose for 5 seconds. Exhale slowly through your mouth for 5 seconds. That's 1 breath. 10 seconds total, 6 breaths per minute. Continue for 2 to 3 minutes. The key elements: breathe through your nose on the inhale. This triggers nitric oxide release, which promotes vasodilation. Breathe through your mouth on the exhale. This allows complete exhalation without restriction. Keep the breath slow and steady. Don't force it. If 5 seconds feels too long initially, start with 4 seconds. Inhale, 4 seconds, exhale, and build up over time. If your mind wanders, gently bring attention back to the breath. Count the seconds if it helps. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Why does this work so well for adults over 60? As we age, the autonomic nervous system becomes less flexible. The parasympathetic response weakens while the sympathetic stress response tends to linger longer. Resonance breathing directly counteracts this imbalance. The 5-second inhale temporarily suppresses parasympathetic activity as heart rate increases slightly. The 5-second exhale restores vagal activity as heart rate decreases. This rhythmic oscillation, repeated over several minutes, strengthens the baroreflex, the feedback loop that keeps blood pressure stable. Research shows that even a single 2-minute session of slow breathing can increase heart rate variability, indicating enhanced vagal activity. Regular practice over weeks and months produces lasting improvements in autonomic regulation. Let me tell you about Bernard. Bernard was 69, with blood pressure that spiked whenever he was at the doctor's office. Classic white coat hypertension. But even his home readings were elevated, averaging around 148/90. Bernard was skeptical about breathing exercises. It sounded too simple to work, but he tried the resonance breathing protocol, 2 minutes of 5-second inhales and 5-second exhales, every day after his isometric exercises. The first thing he noticed was how his heart rate dropped during the breathing. He bought a simple pulse oximeter and could watch it happen in real time. His pulse would go from 78 to 64 over the course of 2 minutes. After 3 weeks, his home blood pressure readings started coming in lower. By 8 weeks, he was averaging 132/82. His doctor was impressed enough to delay the medication discussion. Bernard now does the breathing twice daily, once after his morning routine and once before bed. He sleeps better, feels calmer, and his blood pressure is the best it's been in years. Comment breathing if you're going to add resonance breathing to your daily routine. Comment skeptical if you're not sure this will work and want more evidence. Now, let's cover the final component. Minutes 8 through 10, strategic hydration. This is the piece most people overlook, and it's remarkably effective. When your body is even mildly dehydrated, blood volume drops slightly. To compensate, your blood vessels constrict to maintain adequate pressure for organ perfusion. This vascular constriction raises blood pressure. Most people think they're drinking enough water. They're not. Studies show that a significant percentage of older adults are chronically underhydrated without realizing it. The thirst sensation diminishes with age, so you can be dehydrated and not feel thirsty. Here's what happens when you drink 12 to 16 ounces of water. Blood volume increases, vascular resistance decreases, strain on the heart reduces, and blood pressure often drops measurably. But there's a right way to do this. Gulping water quickly doesn't produce the same effect as slow, mindful sipping. Here's the protocol. Sit comfortably. Have 16 ounces of room temperature water ready. That's 1 standard water bottle. Over 2 to 3 minutes, take small, steady sips. Don't chug, don't rush. As you sip, focus your attention on the sensation. Feel the water in your mouth. Notice it as you swallow. Follow the sensation as it travels down. This mindful approach does something interesting. It further stimulates parasympathetic activity, reinforcing the calming effects you just created with the resonance breathing. The act of slow, conscious drinking extends the vagal activation. Some people find it helpful to count sips. Others prefer to time it. Either way, the goal is consuming the full 16 ounces over a few minutes, not all at once. After you finish, sit quietly for another 30 seconds to a minute. Let your system absorb and adjust. Let me tell you about Maureen. Maureen was 74, with blood pressure around 144/86. She'd been on the same medication for years with decent but not optimal control. Maureen had never been a big water drinker. She might have 2 cups of coffee in the morning and barely anything else until dinner. She didn't feel thirsty, so she didn't think about it. When she added the strategic hydration piece to her routine, she was surprised by how different she felt. More alert, less fatigued in the afternoons, and her blood pressure readings started dropping. Within a month, she was averaging 134/78. Her doctor noted the improvement and suggested she was probably mildly dehydrated for years without knowing it. Maureen now drinks water consistently throughout the day, not just during her morning routine. She keeps a water bottle visible on her kitchen counter as a reminder. Comment hydration if you realize you probably don't drink enough water. Comment already hydrating if you already have a good water intake habit. Now let me put the entire 10-minute routine together. Minutes 0-2. Wall sit. Hold for 2 minutes at a challenging but comfortable angle. Minutes 2-3. Rest. Just stand or sit. Let your muscles recover. Minutes 3-5. Plank. Hold for 2 minutes in whatever modification works for you. Minutes 5-6. Wall sit again. Another 2-minute hold. This completes 6 minutes of isometric arterial flexibility training. Minutes 6-8. Resonance breathing. Sit comfortably. Close your eyes. Inhale through nose for 5 seconds. Exhale through mouth for 5 seconds. Continue for 2 minutes. That's 12 breaths total. Minutes 8 to 10. Strategic hydration. Slowly sip 16 ounces of water over 2 to 3 minutes. Stay mindful of the sensation. Total time, 10 minutes. This routine addresses 3 distinct mechanisms: arterial stiffness through isometric training, autonomic imbalance through vagal nerve stimulation, and vascular resistance through hydration. Do this every single day for the best results. Consistency matters more than intensity. The best time is morning, ideally after your usual wake-up routine, but before the demands of the day begin. Pair it with an existing habit to make it stick. Do it right after brushing your teeth, or right after your morning coffee, or right after taking your medications. Track your progress. Check your blood pressure at the same time each day, ideally in the morning before the routine, and then again after the routine to see the immediate effect. Keep a log of your readings. If 10 minutes feels like too much initially, start with 5 minutes. Do shorter holds, fewer breaths, less water. Build up over weeks. Consistency beats intensity every time. Let me tell you about one more patient. Raymond. Raymond was 78 years old. He'd been on 3 blood pressure medications for over a decade. His pressure was controlled, averaging around 132/78, but he hated taking all those pills. He had side effects. He had costs. He wanted to simplify. His cardiologist said it was unlikely he could reduce medications at his age. The research supports keeping older patients well controlled, even if it requires multiple drugs. Raymond started the 10-minute routine anyway. He wasn't expecting to get off medications. He just wanted to feel better. After 3 months, his blood pressure was consistently in the 120s over low 70s. His doctor was monitoring closely. At 6 months, still holding steady, his doctor agreed to try reducing 1 medication. Raymond is now on 2 medications instead of 3. His blood pressure is actually better controlled than before. He has fewer side effects. And he has something he didn't have before: a sense of active participation in his own health. That's what this routine offers. It's not just about blood pressure numbers. It's about taking back control from a passive pill-taking approach to an active, engaged approach where you're doing something every single day to support your cardiovascular health. Comment, starting today. If you're going to begin this routine immediately. Comment, sharing this if you know someone who needs to see this. Before I close, let me address some common questions. Can I do this routine if I'm already on blood pressure medications? Yes. In fact, the research specifically shows benefits in medicated patients. Your medication provides one layer of control. This routine provides additional layers that work through different mechanisms. Just monitor your blood pressure closely. If your readings start getting too low, talk to your doctor about potentially adjusting your medication. What if I can't hold a wall sit or plank for 2 minutes? Start wherever you are. Even 20-second holds produce benefits. You'll build endurance quickly. The key is consistent practice, not immediate perfection. How long until I see results? Some people notice immediate effects on their blood pressure readings right after the routine. Sustained reductions in baseline blood pressure typically emerge after 4 to 8 weeks of consistent practice. The research shows continued improvement through 12 weeks and maintenance thereafter. Is this routine safe for everyone? For most people with hypertension, yes. However, if you have unstable angina, severe arrhythmias, or uncontrolled blood pressure above 180 systolic, consult your doctor before starting isometric exercises. The brief blood pressure elevation during the holds could be problematic for some individuals. Can this routine replace my medications? That's a decision for you and your doctor. This routine can be a powerful complement to medications, potentially allowing dose reductions over time. But don't stop or reduce medications without medical supervision. Blood pressure control is too important to guess at. I'm Dr. Elizabeth Blackwell. If this video gave you a clear protocol for lowering your blood pressure naturally, subscribe to this channel. I create content that bridges medical research and practical health strategies. Share this with anyone you know who's struggling with blood pressure. Share it with people who want to do something proactive about their cardiovascular health. Share it with anyone over 60 who hasn't been told about the remarkable power of isometric exercise. One final comment request. Comment 1 of 3 things. Comment implementing now. If you're going to start this 10-minute routine today, Comment "Need more info" if you want me to create more detailed content on any component of this routine. Comment "Success story" if you've used these techniques and have results you want to share. Your blood pressure is not just a number, it's a window into the health of your entire cardiovascular system. Every point you lower it naturally reduces your risk of stroke, heart attack, kidney disease, and cognitive decline. This 10-minute routine gives you a tool to actively lower that risk every single day. The research supports it. The mechanism is clear. The only question is whether you'll use it. 10 minutes a day. That's all it takes. Take care of yourself, and I'll see you in the next video.